Hello and welcome to 5 minutes on the top stories of this week's IACM Bulletin. First placebo-controlled trial of cannabis for migraine shows significant pain relief. Inhaled cannabis reduced migraine pain according to the first placebo-controlled study with 92 patients. Researchers at the University of California in San Diego treated adults with migraine with either cannabis flowers with 6% THC, or with 11% CBD, or with 6% THC and 11% CBD, or they were given a placebo, that is cannabis flowers without cannabinoids, in a random order for different migraine attacks. Cannabis flowers with THC and CBD were superior to placebo in terms of acute pain relief and freedom from pain after 2 hours, as well as sustained freedom from pain after 24 hours. The THC dominant strain was superior to the placebo in terms of pain relief, but not in terms of pain relief after 2 hours. However, the CBD dominant strain was not superior to the placebo. Regular cannabis users may have a slightly increased risk of heart attack and stroke. Over the past years, several studies have investigated a possible link between cardiovascular diseases, such as heart attacks and strokes, and cannabis use, with varying results. Sometimes no connection was found, sometimes an increase in risk was observed. In the most recent study from the USA, with around 400,000 participants from 27 states and 2 territories, daily cannabis use was associated with a slightly increased risk of cardiovascular disease in adults aged 18 to 74. The authors from the University of California in San Francisco and the Massachusetts General Hospital in Boston concluded that cannabis use is associated with adverse cardiovascular outcomes with higher levels of use for more days than per month, associated with a higher likelihood of adverse outcomes. Thailand. The new government wants to ban the recreational use of cannabis. Thailand will ban the recreational use of cannabis by the end of this year, but will continue to allow its use for medicinal purposes, according to the health minister. Thailand was the first Southeast Asian country to liberalize medical use in 2018 and recreational use in 2022. New York allows adults to grow their own cannabis. The New York State Cannabis Control Board has passed rules that allow anyone over the age of 21 to grow their own cannabis plants at home. THC and CBD exert their pain-relieving effects via different receptors. Studies from the University of Montreal in Canada using a nematode showed that CBD and THC target different systems, namely the vanillate and the cannabinoid systems, respectively, when it comes to their pain-relieving effects. Nanoparticles containing CBD can help prevent ulcerative colitis. In a study from China, CBD nanoparticles improved the damage to the colon in mice with ulcerative colitis. They restored the barrier function of the intestinal mucosa. More importantly, CBD significantly improved the species composition, abundance, and amount of short-chain fatty acids in the intestinal flora of these mice, thus maintaining the balance of the intestinal flora. Acetylcholine and CB1 receptor activation show synergistic antidepressant effects. Results from studies in mice suggest a synergistic action between acetylcholine and cannabinoid CB1 receptors in modulating depression-like behaviors in mice. Acetylcholine occurs naturally in cells and is available as a dietary supplement. Perhaps a combination with THC-containing cannabis would be therefore useful. CBD can mitigate the lung damage caused by methotrexate. Studies with rats show that CBD has the potential to mitigate lung damage caused by methotrexate. Methotrexate is an immunosuppressant used in the treatment of autoimmune diseases such as ulcerative colitis. CBD has a positive effect against certain parasites. Cystic echinococcosis is a worldwide parasite disease caused by infection with the larval stage of a parasite called Echinococcus granulosus sensu lato. Studies with mice have shown that CBD increases efficacy with a drug used against this disease. CBD may help preserve muscle mass in cancer. According to studies with muscle cells, CBD could be used as an aid in the treatment of muscle loss in cancer to preserve muscle mass and improve patients' quality of life. Cannabinoids can be helpful in wound healing. According to a review, animal studies suggest that the use of cannabinoids can improve the healing of postoperative and chronic wounds. There are few human studies examining the effects of cannabinoids on wound healing, and many of these are case series and observational studies. They suggest that cannabinoids may have some benefit. These were the top stories of the IACM Bulletin. Thank you very much for your interest.